While we're eating, my name is Dr. Arnette, for those of you who have not met with me, and I'm very honored to be here on the panel with Dr. McCannel.
I've just been chatting to Dr. Arnette before, and I'm amazed at all this.
What are you guys doing for this?
Amazed at all the information and all the things we need to do to look after our whole health. So, with that,
Here, I'll go in. We're going to take, I think would be appropriate for today's format is for Dr. McCannel and I to take 5 minutes maybe and talk a little bit about how we view what we're bringing to the state, to the table here today, and then we want to open up to Q&A. We feel that there's a meeting of the minds here, and we're not just looking for answers, we're looking for different answers. So the same question posed to 2 different styles of physicians may be able to offer great insight and hopefully an interesting hour while you eat. So, Dr. McCannel is eating. I will take my time for a moment. I'm Dr. Arnette. I'm a practicing acupuncturist, chiropractor, functional medicine specialist in Long Beach, California. I've been at this for 30 years. And what I bring to the table is that on my tombstone, when I go out of this place, I wanted to say, here was someone who wanted to remove the walls between medicines and have integrated be the primary thing, so that the patient can simply benefit from what is the best, regardless of if it's old or new, whether it's Eastern or Western, as long as it's helpful in helping an individual find their leg of the journey, I find that to be very helpful. And I feel confident that Dr. McCannel shares that view from her side, so let me give the floor to her.
thank you. I am a traditional Western physician trained in the most, I would say, ancient way that doctors are trained. Went to medical school and residency and fellowship, and all of my mentors and people who have taught me over the years are very traditional, and unfortunately not a lot of my colleagues and mentors would necessarily feel comfortable in this forum talking this way. And I think that, I too, when I was in an earlier stage of my career, might not have had that appreciation for a person's entire health and wellness. So I'd have to say that in the last few years, when I realized that I've been doing this for over 15 years now, and the exciting things to me are not a new surgery or a new drug or operating on the eye, and yes, it's extremely cool. But actually what has become more meaningful to me is meeting all of you, and meeting people, and really learning about what it is that I need to do to help that person. And the same medicine or injection might not be necessary for person A or person B, but to figure that out, you have to actually use more than what you learned in medical school. So I think what I'm talking about is sort of this, you really have to look at the whole person. And we can't just look at your images and pictures and scans and come up with a plan. You have to talk to a person. And you're not going to figure out what a person's problem is unless you talk to that person and find out how whatever it is affecting them. So I feel that I'm sort of evolving in my own career and learning what's really important to people is how we can best learn to take care of them. And doctors today really need to start speaking to their patients and understanding them and looking at the whole person. And many times in my office, once we got the eye sorted out, I'll ask, well, how's everything else? And people will bring up all sorts of other concerns, and I think all the time people talk about, well, I have this sciatica, and no one seems to know, or this doesn't work, and I always try to think of what can we do to sort of figure that out. Maybe I might know of somebody I can send you to. And at UCLA we have a Center for East-West Medicine, and I'm constantly recommending that people check them out, and because they have a very whole body approach. They're going to ask questions that your regular doctors would never ask, like how much you sleep, or what are your bowel movements like, or what do you eat. And these things are really important because we are, our body is not an isolated eyeball. We're connected to everything, and something that happens elsewhere is going to affect the health of your eye. So that's kind of where I'm coming from, and I think that there's a lot of work to be done in medicine and in our residents and trainees, and the people who are coming up and who are going to be replacing us need to have this understanding. And I think that we are sort of entering a new era, as we talked about. Dr. Ned and I were speaking about what's happening in medicine. I think we are coming to terms with how our American culture of health.
Well, I'm floored to hear a Western MD surgeon say what she just said. I'd like to have a round of applause for that. I came to know Dr. McCannel through a patient that we have here. Sherry, you want to raise your hand? Say hi. So there's our intermediary. And I've been doing the work that I do for about 30 years. I'm really 90. And the work that I do is what used to be called holistic. Holistic as a word got beat up because it was a way in marketing, to promote other styles and so forth. And there certainly are moments where holistic does not apply. I would venture to say at the moment of surgery, what your emotion are at that moment is less important than what's happening under the knife or under the laser. And so there are moments where we need more than one philosophy, more than one way to look at something. For as you come out of the surgery room, then you may need to be involved in what else is going on with that patient. And so to be able to have both approaches sitting at the same table is the crest of the wave of what human beings have come up with so far. So I'm very proud to be part of this crest of the wave experience here that's being propagated by patients who are suffering, asking for clarity. Ironic you guys ask for clarity. That's fun. So then let's get this started. So what I want to do is to pose some kind of open-end questions, and we'll definitely have time for you guys. More time for you guys than what we're proposing. And I'd like to hear some contrast between us. You don't want to hear us just agree on everything, that would be boring. And we want to hear some differences. How would we approach things differently? Maybe slightly different views, and not to be right or wrong, but to stimulate that new movement forward. So a common thing that comes into me, I'll just get the ball rolling with one of my subjects. It happens a lot. A patient's just been recently diagnosed with cancer, and they come to me and they say, I hear that nutrition can help, but my doctor says that food doesn't have anything to do with my cancer. That's a very real question. Have you had any patients come into you with that level of question, wondering if something like food could be helpful, or them being told that those are not helpful items?
Well, I think a lot of times when someone suddenly receives a diagnosis, it's very natural to try to, everybody asks themselves, well, what did I do wrong? Why did I cause this? And I think that in Western medicine, the immediate answer is, oh, no, this is just random. Nothing you did could have prevented this. And I'm not so sure if that's completely true, but there certainly is nothing at the moment that a person can do. And I think that when a person brings up, could food have caused this? I mean, I will say, well, I just don't know. You have to discuss with a person who's an expert on nutrition and figure out what the person's been doing and how they've been eating. And I know that's definitely out of my expertise, but perhaps it would be helpful for a person to speak with a nutritionist or to, and I think a nutritionist, and a good friend of mine who graduated from medical school with me is now forming the new Canadian food guide. And we got together because she was in town for a very large diet meeting, and I have no idea she was doing this because she's an anesthesiologist. And I said, oh, what are you going to do during the meeting? She told me what the meeting was, and I was so shocked. But so the way that nutrition is, and what traditionally has been known, I think, is evolving. And a lot of people who are dietitians and nutritionists may not be necessarily current on what are some of the latest trends. And this is something that is a moving field, and I'm sure Dr. Arnette is aware of this, but you have to really get a lot of opinions and experience and talk to people who you feel comfortable with. And I think diet nutrition is something that's very tricky. But I think that I would encourage people to explore that as one of the things they may consider modifying to improve their health. If there's a thought that eating a certain way in some way contributed to developing the cancer, then certainly if you make a change, you may be able to improve that somehow, even in the recovery.
Excellent. I would agree with that. I think that nutrition is a complicated issue. I whittle it down. I think nutrition is a psych issue. You cannot talk to any real patient without it mostly being a psychological conversation when it comes to food. I mean, to tell you what foods to eat or not could probably fit on a sheet of paper. And if all it took was just pure knowledge to make change, then the whole world would not need anybody, right? We'd all be just good to go. And I venture to say that even if we eat perfect, we're still going to need excellent physicians because life is just complicated out there. But here's the thing about eating right that I say, I don't think there's one way to eat right. I don't think there's one way to eat, even when a diet matches a patient, that's the only thing they're ever going to eat the rest of their life. The first thing that happens when you start talking about diet is patients immediately think of the one thing they love and immediately put a big X in front of it and think they're now suffering in jail because they can't ever have their, whatever their thing is, and suddenly their life is, well, maybe the cancer could kill me quicker because I can't imagine life without eating my fill in the blank. So it's a psych issue. It has to be dealt with at the tenderest of heart and the greatest of patience. Patience doesn't mean waiting, patience means understanding. I met a cardiologist once at a meeting years ago, and I said, do you use nutrition in your practice? And he said, I did when I was first out of school, when I was naive. That was his word. That perked my ears. I said, well, what do you mean? He said, well, when I was first out of school, a patient would present to me, I would give him a sheet, here, don't eat that. They'd come back 4 months later and would have gained 5 pounds. So as a doctor, I realized that food doesn't work. I said, now let me get this straight. You told them what not to eat, not what to eat. You didn't check them for 4 months, and they only gained 5 pounds. And you insulted them or lambasted them or made them the enemy or the problem. And he kind of looked at me, it was a party, and he said, oh, I see what you're saying. I said, you probably do excellent work, sir. There's no comment about the word. I'm not here to do that. We're at a party. But if you're going to deal with food, it's a psych issue. It doesn't happen by just giving a sheet of paper. That's why it's practically difficult also in the system for even good, well-meaning physicians to be able to give the time necessary to pull that out of each patient. I believe that it takes a village. In today's world, if we're going to remove that wall and have integrated, well then we need many people at the helm of their specialty, so to speak, but integratively interacting with each other. Does anybody have any question regarding food or food and cancer, or how food or functional medicine or Western medicine sees that? There's several subjects I want to go over, but I definitely want food to be one of them.
I have a question about supplements versus getting all your nutrition from regular, real food, whether it's organic or whatever. I found sometimes when I seek out many complementary and alternative medicine practitioners to support me just in general life. When I talk to traditional medical doctors, there's a lot of suspicion, well, you can't rely on the supplement because you don't know it's not regulated. And so what opinions do you have of us being able to boost our health through use of supplements or not?
Excellent question. I definitely would like to hear both of our answers. So I got the mic, I'll start. Supplements are basically 2 types to make it easy for your question. Let me rephrase the question so everyone heard. Basically, can you get all your nutrients from food, or do you need supplements? All supplements are not the same, so how do you trust what supplement? And even third question, how can you help your MD, who might even be on board, help them because they're too busy to go look this up themselves? Did I get your questions? Okay, so these are very real questions. The supplement industry is not regulated, and that's really a good thing, but it just means you have to be smart. When you go to buy a car, do you just walk onto the lot, or do you do any research? Does anyone in this room just walk onto a lot and buy a $50,000 car? No, you do. More people do research on their car than they do on their supplements. People have this idea that if 1-a-day and Centrum are good for you, then you should buy your vitamins at the absolute cheapest place possible, almost like a Costco consciousness. Well, it just turns out that there are unscrupulous ways to put vitamins together, and there are scrupulous ways to put vitamins together. It depends upon the company, and companies only exist in response to who's buying their product. So as the customer base starts to ask more questions at the health food store, at the doctor's office, at the nutritionist functional medicine office, because we have access to really good high quality stuff, but it doesn't have marketing behind it. The stuff that has marketing, the 1-a-days and the Centrums, do you know that when we have rainstorms here, they find thousands of 1-a-days that have digested through people's bodies still intact with the label still on it? Yeah, the vitamins cannot be compressed. A vitamin is not a vitamin is not a vitamin. Nevertheless, first question, can you get your food, your vitamins from food? I would recommend trying as your first goal. I do not recommend eating, I'm sorry to say the word, crap food, and then taking a vitamin to try to support that. So I don't agree with that. When it comes to basic vitamins and minerals, we want to do our best to get it from our diet. However, not all supplements are vitamins and minerals. There are herbs, there are other nutraceuticals as we're coming out, things that help with more advanced stages of chemistry that you're not really going to get in your food per se. So the word supplement means to supplement the diet, which implies that you've got to have a good diet or nothing is really going to work long term. And I will tell you, that's just the truth. I didn't make it up, I'm sorry. I can't get you out of jail. I can't write you off with a little note saying, well, you can eat the cream puffs, but everyone else needs to not. I can't do that for you. Your poor digestive system is trying to keep up with all the stuff you put down your throat, trying to put up with your personality identities. I have to have this food or I'm going to die. Maybe that personality should die. Then you'll start eating foods that make your body feel better. And that does not exclude cookies. It does not exclude delicious foods, although it may for a short period.
Well, I'm not an expert when it comes to nutrition, but I think I answer a lot of these questions just with my own common sense and experience. And I think that the reason a lot of people want supplements and want extra pills is because it's easy. You just take a pill and you're done. But I think what you were alluding to is that it matters what else you eat. So I also agree that a supplement or a vitamin is really not going to replace the benefit of eating healthy. And in general, I tell my patients if we start talking about nutrition, I say that choose to eat something that came from nature instead of made in a factory. If you kind of focus on like vegetables and fruit and things instead of things in packages, and focus on a balanced diet, and some of the trends now are maybe less carbohydrates, more protein, eating well with exercise. Most people don't need supplements, in my opinion, but I'm not a dietitian, so it's hard for me to say that. But I think focusing on a healthy diet overall, you can save your money and get good quality food and good food, and maybe skip the extra pills and things, because I'm not sure. I think in certain age populations, a multivitamin might be helpful if a person is concerned they're not getting the basics. But if you focus on a healthy, well-rounded diet, I don't think you need extra pills and medications. But I will not speak to herbs, because that's more of your area.
Well, the challenge is that herbs come in pills. So, pills are part of our future. No matter what's in the pill, they're part of our future. So we might as well be practicing taking supplements twice a day now. So, because when grandma comes at 94 and she complains she can't take all the supplements, I'm like, that's a lack of training. Because you can do anything you want that you're used to, really. And so as we get into those light years, we will probably be a little bit easier. But it is a slippery slope. If a man comes into my clinic and he's a triple wide and he's totally stressed, that was funny. It's a Texas reference to trailers. And he's stressed, well, I could tell him how to eat the best diet, and it is extremely unlikely that tomorrow he will do that. Even if he looks at me and says, I like your idea. He may need some supplements in the beginning, almost like what I call a cast on a wound, to help get him from point A to point B. And if he sticks with me long enough, my goal from the beginning is to get him on a better diet, using less supplements, not because I believe in less supplements, I believe in more diet. Why? What happens when you make your own food? You're thinking about it, you're smelling it, you're engaging with it, you're activating the elements that actually improve digestion. The number one organ in Chinese medicine to pay attention to is the digestion. Chinese medicine says the heart is a patsy organ, falsely accused. It's only bothered by wrong thinking or wrong eating. Both of those are gastrointestinal issues. If you focus on how you think and how you react to your thoughts, and you focus on what you eat, every other organ does good, because nature makes nature. But in our country, the cardiologist is the highest, most exalted person, and the nutritionist is down. Do you believe in nutrition? I don't know if that's necessary. So we're kind of the exact opposite. I propose it's largely because we have done what no one else has done, and that's to save you from the brink of death. And I think that's a miracle. And I love that we have cardiology. But it doesn't change the reality that it's mostly bothered by how you think and emote, and how you eat, and how you move. That's what bothers the heart. You want to have a good, healthy heart? You don't need to take supplements in exchange for exercise. But if you exercise right, you're probably going to want to take some supplements because there's some cool ones out there, but that's a choice that's different than need. Okay? Very, very, very important. Supplements are also a way for us to be able to get concentrated nutrients in us during a time where we may need a great deal, like going through chemotherapy or going through radiation, where we simply may be having nutrient depletions from the procedures themselves. We may need concentrated nutrients for a short period, but the goal is not to leave people there. The goal is to get people back as quickly as possible into improving their diet. The Chinese have a phrase, and I say that not only because I represent that, but they're a really old, good medical system. They say, as soon as hunger is gone, death is imminent. It is the desire to digest life and food that is the example that the being is alive. So many people wish they didn't have an appetite. I'm like, well, you don't know what you're wishing for. Because they don't mean that. What they mean is they wish they could stop the compulsion, and that's a different story. Thank you for your question. Other questions? Yes, please.
I had a question about, it's pretty well established that there are certain vitamins that people take for macular degeneration, right? And that there's research on that. Would that not kind of speak to the possibility those would help the eye in general for anyone who has eye issues?
That's a great question. So we know that in macular degeneration that certain high-dose multivitamins have been shown to be helpful. But let me give you a bit of background on that bit of data. So the data that showed that high-dose vitamins, certainly we call them the AREDS2, they're a combination of high-dose vitamins higher than a multivitamin. That data showed that a person with moderate dry AMD, so macular degeneration affects the central vision. Most people have dry disease and it kind of minimally affects the vision to sort of kind of affect your contrast a little, and then a small percentage have very serious bleeding wet macular degeneration. When people who had moderate macular degeneration took those high-dose vitamins, it lowered their risk of progression by a very small percentage, like less than 20%. So even people who have a few little signs of dry macular degeneration, technically they shouldn't really benefit at all, according to that data. But because it was a very large study, and it may be, for people who have the worst type of macular degeneration, it's something to reduce the progression of, say, a fellow eye or even the disease in general. I really think that macular degeneration people who have that disease are really the only ones that benefit. But we often have a lot of patients just decide to take those same vitamins with other conditions or with other diseases, thinking that it may be helpful. But there is no data that it helps those individuals. So again, I get into the discussion of, instead of doing this, do things that are healthy for your heart. And I think in ophthalmology and certainly in retinal disease, a healthy cardiovascular system also is correlated with much minimal macular degeneration, and I do think it correlates with any vascular disease in general in the eye. So if you want to do something healthy for your eyes, have a healthy heart. So make sure your blood pressure is under control, you exercise, good state of mind, all those things will be helpful.
The other thing about high-dose vitamin is it tends to burn out the stomach, because you have to then go, well, what are those vitamins, where they come from? I think the number is about 85% of vitamins are made from petroleum distillates, because real vitamins from food cost more money than the manufacturer wants to put into it. They'll only sell to cray-crays like me and the patients that I treat. So I've got the good stuff, but it costs a little bit more and it stinks. It's not cherry flavored. So there is a problem with high-dose vitamins also. What I believe is kind of the pink elephant in the question is that we're trying to make a vitamin act like a pharmaceutical. Can we get a laser-specific, super fast acting result from that said vitamin or collection of vitamins? And I would venture to say that that is putting the vitamin in the wrong gun. That's not the way vitamins, I believe, are really designed to work. A person who's at a moment of crisis needs to try things, I get it. But as the clinician, I will say most of the time high-dose vitamins are short-acting. It would be more like a pharmaceutical agent, and it can have some negative consequences. What I would rather do, exactly like what Dr. McCannel was saying, is let's look at the rest of their health. For if their heart is disturbed, that means they're anxious. And anybody who's perpetually anxious is going to have a very difficult time healing from things. But anxiety is so common that everyone goes, oh, well, everyone's anxious, so what does that mean? It means everyone needs a lot of help. That's what it means. Vitamins do not save anything. Vitamins are like putting minerals in your ground. It's like putting fertilizer on your soil, right? It can help, but it doesn't do it. If you don't have light and water and good soil, the vitamin can't fix it. Does that make sense? Did that answer your question?
Yeah.
Thank you so much. Yes, sir?
What do you say about intermediate fasting?
Intermittent fasting. I'd love to answer this. This is a good one. The joke is we've run out of supplements, so now we're going to try not eating. I mean, that's the humor. We can be humorous about things. Intermittent fasting, or fasting in general, is coming back to something that man has always done. Largely because man went through periods where he didn't eat. For practical, he couldn't eat. There wasn't food around or what have you. And it turns out that the body's designed for those states. And it turns out that the body was not designed to eat 3 meals a day every day for the rest of your life. Even if it's good holistic food, right? It's just not. No human, except for the last 100 years, really ever did that. When I was in China, they frequently would look at me and they'd say, "Oh, you American, you guys have all the diseases you have to eat your way into." I'm like, what? You have to be rich enough to have diabetes and cancer. We not have over here. I'm like, what? Well, it turns out that the data in their extremist of poverty regions, they don't have cancer, diabetes, heart disease. They don't have those diseases. They have other ones. So this is not a so funny joke. We're eating ourselves into our illness. Not just the bad food, even good food, but too often, too much. In this damp heat weather, it's like the universe is saying, if you're right here, don't eat. Just try to exist. Just try to survive. But I'm from the South, and they like their chicken fried steak and mashed potatoes. It don't matter what time it is, honey. I'm going to have macaroni and cheese and fried chicken right now in the middle of this damn heat. And then when I get indigestion, I'll take a Tums. Ooh, that'll make me feel good. Isn't that healthy? That's what the doctor says. These are crazy. I'm being funny. I'm trying to exaggerate a moment of culture to help us realize that we really have more even answers already in place. We don't necessarily accept the advancements of surgery and progression of pharmaceutical agents. We know a great deal of what it takes to be healthy. So the last thing I'll say is the eyes or the liver. If your liver is congested with anything, you're likely to have blocked eyes in some way. One of the things I'm able to do really well, not I, Sherry and I do well together, is keep her glaucoma down, naturally, by working with breath, working with yoga, working with palming, working with nutrition, and solving the anxiety points, and helping to give time and space for that.
I don't have anything else to add because I haven't had such experience going to China, but I think that a lot of what you're saying is absolutely true. It's interesting you mentioned the eye and the liver, because one of the things that when I sort of stumbled upon acupuncture and Chinese medicine, which literally stumbled upon, I really no knowledge at all, except that I knew it was an alternative form, was that this connection between the eye and the liver. Did you know that scientists have no idea why ocular melanoma spreads to the liver? It's like such an enigma. It's so strange and weird that why no other cancer kind of hones in on another organ. So I think that to me was like, you know what? We don't have all the answers in Western medicine. We have to listen to what other types of health care are there. And there's something in Chinese medicine and the eye-liver connection that maybe explains why the liver is susceptible, because we have no explanation in Western medicine.
I would simply describe that as a clinical finding. There are three, at least to keep it simple, there are 3 levels of existence. We live in a physical plane, we live on a mental plane, some people only live there. And then we have a spiritual plane. I know that's elusive, but stay with me on that. And so there's different knowledge at different levels. And so knowledge is not on the physical plane, knowledge is on the mental plane. That's why if I tell you what to eat, you won't do it, because the physical plane is what wants to eat. My physical body wants to eat macaroni and cheese, I have to force it to eat celery. It's not easy, and I do this for a living. So the thing is that what Chinese medicine teaches you is that it's everything. It's your mind, it's your sunlight, it's your food, it's your friends. It's the way you sleep, it's the way you poo, it's the way you farted. It's the way you study, it's the way you love, it's the way you become perceptive. All of these elements ultimately factor into whether your immune system has enough energy left over to go fight the bad guys, or whether they're simply distracted dealing with you. You want to consolidate your energy? You want to make a laser bullet towards any form of cancer? Stop being crazy. I'm being funny with that, aren't I? Stop being crazy, because when you're crazy, you distract your energy, you spread your energy to too many different things, and that causes simply not enough resources at home to take care. Does that make sense on the simplest way possible? Consolidating your energy, yes, that can be yoga and meditation and Tai Chi. Those are the ways that we've been given up till now. We want to take those ideas and make them modern with the same intention and the same idea. Yes, please.
I want to jump in here because let me sort of restate what you said in a clinical way, or maybe a less, but actually what he's saying is exactly right. You know, I've read a lot of books in the last few years about how important your mental state is in regards to your whole body health. And we kind of discount that, and we think, okay, I'm exercising, I'm not smoking, I'm eating well, I'm going to the doctor, I'm doing all these things. And we forget about the whole mental component of our health. And in traditional Western medicine, the mental component doesn't exist. We just totally ignore that. It's like body, disease, pathology, fix the problem, etc. And nobody thinks about mental health. Yet mental health is paramount. It's inseparable together with physical health. And you know, when you think of mental health, you touched upon stress and thoughts, and it's also things in your past. And I've read a few books by, there's a physician, his name is Gabor Mate. I know you. He's a Canadian physician who used to work in Vancouver on sort of the Skid Row of Vancouver, and he wrote a book about drug addictions. But he also wrote a book called The Stress-Disease Connection. And I read that book a few years ago. A friend recommended it to me. And it was, I was shocked. I mean, there's scientific data that show that people with certain traumatic experiences or chronic lifelong stresses have a higher incidence of various diseases. And cancer progression is correlated with a stressful background. One of the things, because of all this, I've been working with a health psychologist at UCLA for forever, but what we've been looking at has always been looking at, you know, how does the diagnosis of ocular melanoma affect a person's mental health. So we've kind of turned it around in the last couple of years and let's look at all this prospective data and see, is there something in a person's mental health that maybe makes them more susceptible to ocular melanoma? And I've been constantly struck by people who, you all know the high-risk features, a large tumor, monosomy 3, class 2. And I have patients that I see who it's been 12 or 13 years, and they have all the high-risk features. Massive tumor, they don't have much vision in their eye, high-risk biology, and they're doing great. And all these people share something very unique. They are happy, they're engaged in life, they have things they're doing. There's a lady that I saw she was a band teacher in high school, and she was at UCLA, and she was going to meet a student for lunch, and she's doing all these things, and she was treated before I even started, had a very large tumor, and it just doesn't make sense, because in the medical world we'd say, well, very large tumor, high risk prognosis, this person is not going to do well. And I would say that there are other factors that we don't understand, and I do think it's part of it may be mental or emotional that we need to tap into. And by tap into, I mean look at what you might change about yourself. Or, you know, a patient came to me and said, I'm doing all these things, and you know, I just had a sense that he was a very stressed individual. And I said, have you ever thought of, you know, you want to do everything, have you ever thought of maybe doing a deep dive in your psyche? Maybe you have some issues that you don't even know are there that you might want to address. So I really think there's a lot more that affects how a person does with their cancer than just the basic biology. And I do think a lot of it is mental, and it's not really given much credit in Western medicine, but I would urge you to sort of think about these things and know that there's a lot more that can be done than just you're going to have an outcome like a statistic. And I think that, you know, mental health is huge, and we just don't address that in Western medicine. And I wish there was a good way that I could offer that to patients, and maybe I'll learn some tips through you.
What a miracle. We have more miracles coming out of your mouth. I'm just so thrilled to be sitting here. This is so wonderful. So the way it works from the perspective of acupuncture is that your digestion makes your energy, your raw energy, but your mind is the one that distributes whether it's smooth or whether it's ratchety. So your mind, whether or not it's directly causing a cancer or not, that's the argument that says that the mind is not, because we don't have that data right now. But I'm here to tell you that it's the patterns that you hold in the background of your mind that determine your neural tone as you walk through the grocery store, as you go through Disneyland, as you were sitting right here. And that tone is your energy, your chi, flowing through your body, your nerves, your nervous system, affecting your neurohormones, affecting how you digest, determining whether you're inflamed or not, determining whether you're able to get over the fact that we were running late, or whether you're going to go home and say the entire problem with the thing was that this ran late. You know, people will see what they want to see. Perspective determines whether you heal or not.
Totally agree. I completely agree. Your perspective, you know, the way your mind is thinking about what you're going through has a huge, huge role.
And so, in the multiple people that we see, the physician, unfortunately, is the one who has to say, you've been diagnosed with. Okay, so they have to say that, okay? That's important, so the patient goes through their experience. Someone on their team needs to help unpack that, but not just be the shoulder to cry on and encourage them to feel victim, maybe for the first day or month, because people got to go through their stuff. But eventually, we've got to help them find their strength. And strength is usually only found once a personality identity collapses, and we start to get into something a little bit more fresh. For just like your skin cells that need to exfoliate, so does your personality. Do you ever think about brushing your personality and getting rid of the old stuff and old gunk and old grime and yesterday's outdated patterns that you're still stuck to? You know, I mean, we don't think about it. I'm being slightly humorous here for the point of an educational moment, but really this is where a great deal of the mind-body element comes into play. It's not that you stressed with your spouse today, it's did you allow yourself to move on? Or are you still resentful? And it's not a question that you need to answer me like some quiz. I did, I didn't. I did, I didn't. Not so important. Tell your heart. Tell your nerves. Tell your poor stomach acids. Because the reality is that we're humans trying to figure our way through life, and the number one emotion is fear. And it gets in our way. And it's there to teach us every time. And if we have no fear because someone floats your boat, you're the worst. You're going to have the hardest time. You're so dealing with thick, dense delusions that the world is the way you see it. That's why when people get struck with something like cancer, suddenly they start to snap into some form of reality. How many people on Saturday would choose to go listen to a nutritionist and a doctor talk about health? There's a beautiful day outside. Only the people whose lives have been affected. And because of that, that makes your mind open. And because of that, that means that you're actually going to go, well, what is my energy flow, my electrical flow? Are my nerves working right so that I can help the doctor with the good chemotherapy? And they're better. Immunotherapy's coming out. The surgeries, they're getting better. The radiation, I'm blown away with what she does with the eye. I mean, literally, oh my gosh. So that's all getting better. So we got to do that deeper work. Not to be perfect people, not to be correct people, but to heal. And you only need the lion's share of balance to heal. You don't need to be perfect to heal. That's why the cookie is okay. Try to not eat a crap cookie. Maybe homemade cookies with good organic ingredients. But it's still a cookie. That's not the problem. So our challenge here today is, what do we believe? What do we trust? This was my point in my presentation a couple of days ago. Well, we definitely want to trust science, except that science changes constantly. Every other day they've got a new thing, the new thing, the new thing, the new thing. So I say science is giving us potential. It's at the crest of the wave. But typically it's the stuff that humans have been through for a few thousand years that also has a great deal of value. And I perceive that when we put those two layers on top of each other, we have integrated medicine. We have better outcomes for society as well as for patients.
I completely agree. I think that my view of Western medicine has definitely shifted with my own growth and learning. And there's so much emphasis is placed on medication and drugs. And, I've been to some conferences on the back end where I'm at a conference of new drug development. And, frankly, it's appalling what drives new medicines. And I'm sure I don't have to go into detail, but it's purely financial, and with very, very minimal emphasis on how does it actually help people. And I think that because traditional medicine is very rooted in a certain way of thinking, that many physicians or people who dispense or prescribe drugs sort of fall into this. And I have to say that a lot of drugs, when people want to know the data, the science, and I just a few days ago, I ran into a person who used to work for a drug company, and he kind of was sort of the back end and was sort of putting together the results. And he told me, he said, you know, doctors, we don't even have to convince them with good data. Most of our data that we had was pretty bad. But all we had to do is sort of say the drug a lot, and it got prescribed, and it got the impression that it worked. So, you know, I feel very disillusioned with our whole pharmaceutical industry, and certainly I hope that we have drugs and things that can help reduce cancer progression. But it also makes me think that, you know, maybe the answers are not only on coming up with a wonder drug. Maybe drugs may help, but more and more I'm thinking that what really is going to make a difference is what people do with themselves, and how they learn to sort of get control over your mental state. What Dr. Arnette is talking about, we have all this like chitter chatter going on in our heads. We are our own worst enemies. We destroy ourselves by all the nonsense that we let fester around in our brain. You know, and it's really important to do things that are going to allow you to sort of kind of step outside of that. And you know, I've recently learned and participate in meditation myself, and I cannot say enough about the health benefits. And you can talk about meditation, and anybody here who has ever explored meditation, you know, I did something as simple as I downloaded the Calm app. You know, a friend of mine said, oh, you just got to try this. And I thought, okay, I can do that. That's easy. It's 10 minutes a day. And so I did that. And in about 3 weeks, I felt like a different person. And that's just doing that tiny little bit. And I thought, well, if people could just sort of engage in something like that to kind of tone down your mind so that you can actually just live in the present and enjoy your life, it'll make a huge difference. And these are things that are relatively inexpensive, that don't require multi-million dollars of drug research. And I think that we all need to look at these things because they have a huge effect on your health. And there's a lot of science, even though not that much talked about, that if you can do things like regular meditative practice where you calm your mind, various physiological functions in your body change for the better. And you know, when I started this whole meditation thing, and I like to say this, I'm an example of one, I didn't have a cold, and everyone gets colds. I didn't have a cold for a year, and I think this is because I did something good for myself, you know. But we sort of forget about meditating and calming the mind because those aren't very sexy or cool. They're not a lot of money, and I think the drug industry certainly has a grip on the medical profession, and I think it's really hard to convince doctors to appreciate the physiological value that these things can be for patients. I mean, we're so used to doing things our old-fashioned way, prescribing drugs, prescriptions. You know, you can only fix things with drugs and surgery. But there's a lot of things that you yourselves, as patients, as people, all of us can do to improve our health, that we can do on our own. And so I want you to think that, you know, getting better isn't necessarily in the hands of your doctor, it's in your own hands. Your doctors are there to guide you, and I hope that I can let my patients know of some of these things that you can be doing that can help. But ultimately, it's up to the individual to make those changes yourself. And I think people who have been diagnosed with cancer have this sudden reality check, that they're jolted into, oh my gosh, I have to look at my whole life. Because normally we don't really need to. We just kind of go from day to day, do our thing, and there's really no defining moment where you have to reevaluate and reassess. There's really no reason to, because most of the time things are just fine. And when something major happens, I often tell my patients, you know what, this is an opportunity for you to make a huge change for the better, and you'll be happier once you kind of get into this frame of mind. You know, I've actually had patients tell me that getting diagnosed with ocular melanoma was one of the best things that happened in my life. As terrible as that sounds, you can make something good of anything that happens to you. And I always tell people, it's really up to you. You can decide how you want this to affect you. I know many of you may be familiar with Viktor Frankl, who wrote,
Man's Search for Meaning.
Man's Search for Meaning. I actually met Viktor Frankl's grandson, by the way. I got a photo of him. Anyway, and I read that and I thought, you know, we can decide how to respond to anything. If you're being tortured, you can decide that, you know, this is hurting, but I'm just gonna let it go. And I'm gonna focus on what I think is important. And we can do that. We have the power ourselves to change your mind if you really want to do that. You can choose if you want to have something make you totally pissed off, or take it as an opportunity to grow. And I think when we look at life as opportunities for growth, I think that really helps your health. So that's my little spiritual plug.
We're at the very end, so I want to just leave you to capitalize on that one image. Your nerves are very much like the hair on your head, and if you've been through a lot of life's storms, what would your hair look like? And many people would comb their hair. They wouldn't go 20, 30, 40 years and let those rats fester, and then not rats, but ratted hair. And that would then capitalize problem on top of problem on top of problem, right? You got to comb your hair, and combing your hair makes it healthy. That's what happens when you meditate. It's not so much that any particular time is that revolutionary. Oh, it might be. But mostly, it's just taking a bath for your mind. Give it a try. I am thrilled to have been here with Dr. McCannel. Thank you very much.
It's an honor. It's an honor to be here with you. Thank you.
Thank you very much, everybody.